All right, Dr. Mai, what do patients normally complain about who come in with keratoconus, any corneal transplants, or just any corneal issues in general?
Yeah, they complain about a lot of things, and I'm happy to hear the complaints. I'd say a few things they complain about the most are, one, besides the obvious blurry vision, they mention that things look double to them. So if they see like a moon, they'll see this moon, but they'll see another moon, or multiple moons all around the other moon. So it's a weird, disruptive double vision that they get. And it's not double vision that they get when both eyes are open only, because that'd be where, if your eyes are misaligned, the moons be far apart. Even with one eye alone, they'll see all the moons.
Right.
And this eye alone, they'll see all of the moons. And so not only is it a problem with each eye, but then with both of them, you have like 20,000 moons.
Yep.
And so sometimes they complain about double vision. That's a big one. Another one is glare. So I've had patients that actually, even with glasses, contact lenses, they're able to see 20/20. So they're 20/20. So a lot of doctors kind of write them off. They're like, you're 20/20, stop complaining. But they complain about it because they still see glare. They have a little bit of haze on even when they're reading the letters, they read the letters, but it's a little bit shadowy, a little shadow next to it. They read the letter, but it's a little shadow next to it. So even though they are 20/20, a lot of eye doctors write them off, they also complain about that too. So glare issues, double vision issues, and of course, severely blurry vision.
Okay, so what have we done about that in the past, or how have you treated your patients?
Yeah, so for the longest time, glasses usually don't fix the problem. Otherwise, they don't come to see us if they need a pair of glasses. They can go almost anywhere, right? Even though our glasses are awesome. They usually come to see us because we design these custom-made contact lenses. Rigid gas permeable lenses, scleral lenses, hybrids, everything. And the vision is better with those contact lenses than glasses. The reason why is because when you have that lens on the eye, it almost like reshapes the eye to a normal shape, the cornea. So if they have an abnormal cornea, which is the problem we're talking about here, the new lens will almost like resurface the eye, so the eye is the shape of the contact lens, because it's a hard lens most of the time. That helps a lot, but still it doesn't always correct issues with patients that have like scars. They're able to see better, but even they still see a little shadow sometimes. But it was really, really good. And so before we would say, we do wavefront guided lenses, laser correction lenses, like we hyped it all up, high optics. It really was. That's definitely better than glasses. But patients still complain about the little shadows sometimes.
Right. And so I've heard of something called higher order aberration technology in contact lenses that can help with patients who have keratoconus and any corneal issues like that. But it's been a little bit difficult in terms of the technology and whether we've cracked the code on these lenses or not.
Yeah.
Do you feel like we've cracked the code on it?
Great question. So we've been trying to correct those high order aberrations, is those little shadows I'm talking about. Patients still saw 20/20, but saw a little bit of shadows, had a little bit of glare that we said, that's just, what you have to live with. And your eye looks fine. We kind of try to comfort them. But now, actually, in the last year or two, we were able to capture those aberrations before. So we had technology that could say, yes, the patient saw 20/20, but they actually do see the shadows. We've had that diagnostic capability for years, but we weren't able to do anything about it. We're like, okay, well, we're still going to fit you with these hard lenses. We're still going to fit you with the best glasses we can. We can't actually correct those aberrations in the lens. But now we can, so we're actually able to capture it better now. With our device now, we used to just take a quick snapshot of their aberrations. Now we'll actually scan their eye over a period of time. So we'll scan their eye for 30 seconds, and then we'll average out all the aberrations that the scan got over that 30 seconds and found out how many aberrations there were. And then afterwards, what we did was we put what the device captured, we actually got that and we put it into the lens design to counteract those aberrations. And in my experience, usually the patient will not only see a line or two better than they usually saw. So if they were, let's say, 20/30 before with the best scleral contact lens, we usually get a line or two better afterwards.
Wow.
So that's actually
that's really good.
That's on the chart. Yeah. That's amazing. But the most amazing thing is the subjective experience where they say, you know what, I actually, the glare that I mentioned before, it shrunk and the shadows have disappeared. And that, to me, has been the biggest change.
Yeah.
And so that's correcting the highest level. So we do that here at our office. We call it the hero lens because it saves the day, basically. and I love what we called it. But really, the reason why is because it corrects that high order aberrations finally. Right. We got them seeing 20/20. We were a hero before, but now we also got rid of the shadows around the 20/20 line. So it's just the best lens physically possible today.
Awesome. That sounds really great. I'm really excited for patients to learn about this and possibly give it a try.
Thanks, Dr. Lee.